Hello, everyone. It's time for our start. Good morning, good afternoon, and good evening, dear friends from different areas of the world. It is so nice for all of us to meet online and attend the 20th IACAPAP Lunch and Learn webinar together. I'm Dr. Zheng from Peking University 6 Hospital in China. I'm also the Vice President of IACAPAP. It is my great honor to chair this webinar. First of all, please allow me, on behalf of IACAPAP, to welcome all of you to attend the 20th IACAPAP Lunch and Learn webinar. In this webinar, we will have two sessions. In first session, we will invite Professor Zheng to give presentation. In second session, we will have 10 to 15 minutes for question and answer. If you have any question, please leave it at the question and answer box. Now let's invite Professor Zheng to give presentation. Professor Zheng is a very famous child and adolescent psychiatrist in China. He is the former Vice President of Beijing Anding Hospital, affiliated to Capital Medical University. He is also President of Chinese Society of Child and Adolescent Psychiatry and the Child Branch of China Association for Mental Health. He is Vice President of China Disabled Persons Federation and a former Vice President of IACAPAP. He has rich experience in diagnosis and treatment of child and adolescent mental disorders and did a lot of studies in this field, and he got IACAPAP medal. The topic of his presentation is digital mental health care for children with mental disorders. Welcome, Professor Zheng.
Yeah, experts and colleagues, hello everyone. Thanks for invitation, and thanks for Dr. Liu, Vice President of IACAPAP, hosting the lecture and introduce me. Let me call my PowerPoint. Okay. I'm honored to have the opportunity to talk and discussion about digital health care for children with mental disorders with everyone. You know, with the development of the science and the technological, we have entered the digital age, I can say. So it encompasses in the access to application in of the information and the digital technology in various fields, and this application change our way of the work and the life. So he influenced everything. The combination of the digital technology and innovation thinking has changed our traditional cognition and create many magical results. For example, this 2024 Nobel Prize is in chemistry and in physics were awarded to the scientists specialized in the artificial intelligence. So it's a very magical results, I think so. So advanced in the brain science and the digital technology have established the scientific foundation for the modern digital mental health care. So a lot of scientists do a lot of research focus on the theory of the effective learning and the neuroplastic theory. So we can say digital technology and neuroscience help promote the mental health care. So it's including the online medical consultation and digital therapy and digital biomarker, looking for the digital biomarker and consultating and the predicting the mental health risks. So many areas, say we can use the digital technology. Our research team has a cooperation with multiple digital technology research teams to establish the children's mental health service system, use the big data model and artificial intelligence since the 2016. This team can provide the psychological consulting and psychological assessment and psychological therapy, including the crisis warning, and can also serve as the doctor's assistant to complete the preliminary work and the data processing for the doctors. So I can give the sample of the digital doctor. This generate from one of my photos. So we have also developed digital diagnosis and therapy for ADHD and in recording voice recognition for depression and anxiety, etc. So I can show just finished the digital doctor the sample.
History, symptoms, then contradistinction information before their visit, then generating a case file. This is work of psychiatrists, collecting patients' medical history, symptoms, then contradistinction information before their visit, then generating a case file. This allows doctors to obtain a relatively complete understanding of the patient's condition before they enter the consultation room, enabling more efficient and directed questioning. During diagnosis, there are two types of AI integration being explored. One is the fusion with cognitive behavioral therapy technology, such as the CBT digital person for social anxiety patients, co-developed by JD Health in Beijing and in hospital. In post-diagnosis or for the general mental.
Okay, this not real me. This digital doctor is according to my one photos. Just can set up the doctor system in the mental health care cabin, so we can provide the psychological service for the what can put in the clinical in the including in the school for the public health service also. So I also have the AI psychological companies can provide 24 hours companionship and issue the timely the warning. So this it's very popular in the public area to provide the psychological services. So we also do a lot of the research, including the ADHD diagnosis team and the according to the voice recognition to for diagnosis of depression and in the children and adolescents. So the digital diagnosis and therapy based on the software and such as artificial intellect and virtual reality and games and the smartphone application are in the spotlight as a new diagnosis and therapy alternatives in the children and adolescent psychiatry. So in 2017, the digital therapy alliance was established in the United States. So so far there are a lot of companies and some research group to focus on the therapy, digital therapy and the diagnosis system. So below I will be brief introduce the digital diagnosis and treatment technologies and applications for several major child mental disorders. First the digital intervention for ADHD. You know, the ADHD is very popular in the clinic. In the globally, the average prevalence of the ADHD over the past 13 years about the 7.2%. And in China is about the new research, the prevalence of the ADHD among the children and adolescents is 6.4%. As the type of the neurodevelopmental disorder, ADHD exhibits the significant cognitive deficiencies. Recording these issues, research and products in digital diagnosis and treatment have received a lot of attention in the world. So this a wearable diagnostic assistant system is combined for the routine diagnosis. We combine the conventional diagnosis too. So this sensitivity and the special specificity of the wearable device digital diagnosis have research over the 90%. So it's much better than the routine checklist diagnosis. We cooperation with the digital technological research group to cooperation this research. We also use the digital intervention for ADHD online education. So use the digital education, and is very popular so far in China. So this digital intervention for ADHD is can use the game therapy and also have used the computerized cognitive behavioral therapy, and we also use the neural feedback treatment therapy for the ADHD. This digital intervention for ADHD, the first have approved by the FDA, the digital therapy for ADHD is Endeavor Reacts. This from this game treatment. So there are a lot of same treatment method research in the world. This is my research group focus on the software developed by the mobile device based on the game phototype for ADHD. This development and preliminary feasible testing. So this research is come by the remote control. So it's much better than the control, and there is a significant difference in the effective and the compliance for the certification are very good. So the parents and the children like use the game therapy. So next is the digital intervention for the tic disorders. You know, the tic disorder is also a main problem in the child and adolescent. So its prevalence about 2.5%. So in the past 10 years, in addition to drug therapy, behavioral therapy has received much attention and has become a first-line treatment. There is there are a lot of not enough the professionals, especially in the comprehensive behavioral intervention therapy, and the treatment methods are not standardized, and therefore standardized and easily accessible digital therapy system are particularly important. So recently, Chinese research have successfully developed such the treat system like this one. So we can use a digital CBIT in China to treat the Tourette syndrome and some the tic disorders. From the pro-test and the post-test and the curriculum, the intervention and the evaluation, the report, so can totally a lot of the from the beginning to the end also use the digital intervention. So you know the ASD is also difficult to diagnosis and treatment. So we also use the digital method to diagnosis and treatment ASD. The world, the first company to use the machine learning and easy screen of the ASD in children. So this in June 2021. Congno software Congress directs for the ASD screen and diagnosis receive get approved by the FDA. This in China we some research group focus on the earlier screen software for children's cognitive behavioral abilities based on the imaging and audio recognition technology. So this digital diagnosis of the of ASD. This auxiliary diagnosis tool for the ASD based on the questionnaire and the videos. This named the Also Life Smart Diagnosis System. We also can use the effect and sensitively and especially and accuracy over the 90%. So this another research is use the facial emotion cognition and training system. So it's named FECTS. So cognitive ability assessment and rehabilitation software is on the ABA. It's focused on the ABA. So also and the development of the rehabilitation research. So we also use the digital intervention for the anxiety and the depression disorders. This multimodal technological use the diagnosis depression and anxiety, and also use the multimodal emotion recognition to look to diagnosis the depression, evaluate and assessment depression and anxiety. This the medical technological early value assessment is from the NICE medical technological company. So it's use the online support and intervention for the child anxiety from the mild to the moderate anxiety disorder. This another research is come from the same research team with earlier value assessment is used to online social anxiety cognitive therapy for the adolescents for the mild to moderate anxiety disorder. So this game therapy for the is named Luminova is to treat the anxiety treat the anxiety disorder. So it's from the age is 7 to 12 years old children. This is another research. It's a digital intervention for the depression disorder. It's named SPAPS. We also use the voice features to diagnosis and mood disorder in children and adolescents. So we use the two groups, use the voice features to distinguish the bipolar disorder and the depression. So this is a very interesting research. So there are a lot of research focused on the digital therapy for intervention for the diagnosis and the treatment. So this next the integration of the multiple model collection of the physiological and behavioral, emotional parameters with psychiatric research is becoming the increase close and offering new insights. So the WHO set up the global initiative on the digital health committee. So a lot of government also feel support the development of the digital intervention. In China, the Health China Initiative 2023 this project also promote the digital intervention. We also looking for some information, especially the digital multiple light use the data model has been successfully developing, and the digital therapy is consistently devices and will promote digital services for children's mental health. So the TORUS is building the multi-language model for the medicine. So this good news. So the digital diagnosis and treatment, as well as the digital health services are entering our life. The growth potential of the digital diagnosis and treatment and the therapeutic market for the psychiatric disorders in children and adolescents has been highlighted. Digital transformation in child and adolescent psychiatry will change the diagnostic and the therapeutics redeems significantly. So I'm looking for the promotion to the digital therapy in the for promote the child mental health service. So I use the time to introduce the digital therapy briefly. Thank you for your attention.
Thank Professor Yi for his excellent presentation. From his presentation, we know that the current development the status of digital health care for children with mental disorders, including digital therapy and digital diagnosis, especially the status in China. All these are important for expanding our knowledge and promoting our understanding of this field. Thank Professor Yi very much. Now let's move to the second session for question and answer. From the question and answer books, we could see some questions. The first question is, can you provide a list of research articles on use of digital cabin and ADHD intervention?
Oh, this is very interesting research. We can in China a lot of population, so we have the principle promote the child school children for mental health. So there are no enough child psychiatrists. So we want to use the psychological cabin to use the digital doctors to instead of the counseling, so we can use this cabin to provide the counseling and the diagnosis and the assessment, looking for the earlier problem and transfer to the doctors. So it's I think it's very useful. It can resolve the shortage of the doctors, especially in developing country. So I also can get a lot of information from the children. So to including the crisis warning. So I think this very popular. So can very useful for the rural area and some or area and some long distance the area the children get the mental health service. Okay.
Okay, thank Professor Yi very much. The second question is, can you explain how children with ADHD are able to focus for long period playing online or games?
Oh, the ADHD, the game therapy is I think is very important. In my experience, the ADHD children is very easy, very like to do the therapy. Is much better than use the medication. So a lot of parents and children worry about the side effect of the medication. So it's easy to use the game intervention. But some people worry about the game can be abuse and some addiction. So this worry about this situation. So I know the recording the game therapy, the addiction and about the abuse problem. So I think the first of all, the motivation and the principle behind the game development are different. So the therapy games belong to the serious games. and based on the execution and the functional tasks, rather than the entertaining and the stimulating games. So it's different. And the second is we can abstract time management, and the third one is for diagnosis problem. The ADHD children you can is get the good at the some normal control. So I think this therapy will be popular in the ADHD children.
Thank you, Professor Yi. There are some other questions because the time is limited, so we have some time to answer another 2 questions. And I choose the question. Please wait for a moment.
No, it's I can't answer. Okay.
Can we use Akili ADHD therapeutic innovation for free? Is it accepted all over the world? Okay, so we'll answer this question online. Yeah. The next question is, how do you see digital therapy to become mainstreamed, and what is the role of the regulatory bodies in doing this? How would you know if a particular therapy is effective?
Oh, side effective. I think this is different from the medication and another biological therapy. So just as I said, the side effect, most of the worry about the addiction, worry about the abuse. So if I have the cooperation with the parents to give the explanation and strictly the time management, and I use the just as I said, this games is different from the entertaining and the stimulant games. So it's no enough. I think the side effects now is a smell is a little. So but just like the food, like the water, if you some special person maybe can abuse and some more addiction. So this, but I think this is seldom to problem.
Thank you very much. The last question is, have you encountered in literature some risk or adverse effect on the use of with digital innovations on the mental health of children, especially the ones that use gaming?
This is a good question. I think the very big problem in the so far a lot a lot of company, at least in China, over the 80 company to join the research and cooperation with the clinical doctors. So I think this is a very big challenge and a big opportunity to invent the new intervention tools. So I think this just at the beginning, so this big, I think it also have a lot of difficulties. So we can use the multiple cooperation, so we can do a lot of the basic research, combine the clinic research to resolve this problem. Okay.
Okay. Thank Professor Yi very much. For reasons of time, this is the end of the session for question and answer. Thank participants for your good question, and thank Professor Yi for your excellent answer. Now, the academic part of the webinar is completed totally. We will have some announcement. I will share the slides. The first announcement is that e-certificate of participation will be provided to use IACAPAP members who have attended the webinar and completed the survey at the end of the webinar. Please be advised that the survey for the webinar will be displayed in the browser early after the webinar has ended. The second announcement is that welcome all of you to attend the next IACAPAP Lunch and Learn webinar. The topic is medication adherence in children and adolescents with mental health disorders. The date is January 22, 2025. The time is 12 p.m. Central European time. A speaker is Dr. Alexander Zheng. Please register on the website of IACAPAP. The third is that welcome all of you to attend 27th World Congress of IACAPAP, which will be held in July 2026. This Congress is the most important and most biggest Congress in the field of child adolescent psychiatry. So welcome all of you to register on the website of IACAPAP and attend this meeting. The last is that welcome all of you to join our membership. We welcome interested individuals to become individual member of IACAPAP. For more intervention of IACAPAP membership, please visit a website of IACAPAP. By now, we performed all tasks of the webinar. Before closing, I, on behalf of IACAPAP, thank Professor Yi again for your excellent presentation and answers, and thank all participants for your attending and good questions. Thank all of you very much. We look forward to meeting you in the next webinar and in the IACAPAP Congress in Hamburg. Thank you very much. Goodbye.
Thank you.